Hello everyone, welcome to this video presentation. I am Rosnancy Sinaga and I'm going to present about supervision. It is well established that supervision is a key factor in health and safety performance. Therefore, the priority should be given to supervision, and supervision should be described in a more detailed way. In the current climate of increasing financial that ultimately impacts the quality of care and productivity of staff, the clinical supervision underpins the very essence of good care, and without it, clinicians cannot develop their knowledge, skills, and abilities. Based on the document of Department of Health, it is recognized that activities in clinical supervision is needed to be developed, strengthened, and integrated into the wider clinical governance program. And clinical supervision should not be seen in isolation, but it is an essential element of clinical governance and a journey of exploration and discovery, which embodies professional and personal development with the overall aim of enhancing clinical and professional practice. The supervision will enable the practitioners to develop their skills and knowledge, and also it will enable them to be a problem solver. And it will help also the practitioner to get into their practice. Clinical supervision is an important means of supporting the continuing professional development, and it will embrace in the practice. In the field of education, nursing is one of the most important fields in medical care, as nurses work tirelessly. Nurses tend to treat and care for their patients with the utmost care and support. So in order to be a nurse, there are many educational components that have to be completed. So in the field of nursing, clinical supervision is linked to both education and skill building, and it is seen as an activity that allows for reflection between a skilled nursing supervisor and a newly seasoned nurses. And throughout each supervision session, both the supervisor and the supervisee will build strong relationships that are based on confidentiality, expertise, and respect. Supervision can be defined as a management function that can be delivered by one or more individuals within or external to a team. In the supervision involves controlling, influencing, and leading a team. People with supervisory roles are expected to maintain discipline, to take responsibility, and be held accountable for all the actions of the team. Supervision is an organized, democratic process involving the supervisor and the persons supervised for the achievement of desired objectives. Now viewed supervision as a process of stimulating growth and a means of helping teachers to help themselves, while Ojelabi defined supervision as a constant and continuous process of personal guidance based on frequent visits to the school to give concrete and constructive advice and encouragement to the teacher to improve the learning and teaching situations in the school. So supervision covers a wide range of teacher education processes and activities. It begins before a teaching practice, intensifies through the practice, and continues after the practice has been completed. And supervision includes aspects of advising, guiding, counseling, modeling, coaching, evaluating, and assessing. So supervision is a form of systematic, purposeful behavior having clear aims and destructive content and activities. There are key aspects in effective supervision. The first one is planning routine work for the team, allocating routine work for the team members, making decisions under normal and abnormal conditions, monitoring the team's performance, planning and allocating activities. Another aspect is to monitor health and safety performance, to lead the team during normal and abnormal situations, facilitating communication within the team and between the team and management, to ensure the teamwork and develop the team, to facilitate the workforce, and to apply disciplinary procedures. We will take a look at the roles and responsibilities of educational supervisors. Generally, the school supervisors oversee the administration of the educational institution, but in a more specific way, they have to first to fulfill the educational role, and then they have to participate in induction for the educational supervisor role. They set the time allocated to the delivery of educational supervisor and commit to undertake training relevant to the role of educational supervisor. And they have to demonstrate attitudes and behavior appropriate to the role of educational supervisor, and engage in an annual appraisal of the educational supervisor. They have to engage with quality control processes, and they have to liaise with others, both in clinical departments and with the clinical education directorate, to ensure a consistent approach to educational supervision. And the last is they have to utilize support structures and processes available to assist in the delivery and development of educational supervision role. And within the nursing education area, we need to look at the roles and responsibilities of practice supervisors. They are typically employed by practice experience providers who offer learning opportunities to students of nursing. The supervisors have expertise in the client group and the focus of practice within their particular practice areas. And these supervisors also should available to students in all practice learning environments, both within and outside the students' core practice base. The supervisors are responsible for supervising students and facilitating their learning in complementary or contrasting practice learning opportunities, and to ensure that the student practices within the organization's local policies and guidelines. And the supervisors have the role to feedback the students' performance and achievements to the student's core practice-based mentor. The other roles and responsibilities of practice supervisor is to feedback any concerns about students' attendance, conduct, performance, or progression to the student's core practice-based mentor. We need to look at the job responsibilities of the nurse supervisor in the clinical area. This nurse supervisor manages all of the registered nurses in their team, so they have to interact with patients, but they are mainly in charge of making sure the entire operation is running smoothly and everything is up to code. The supervisor's duties include scheduling hours and assigning nurses to particular patients, but they must evaluate their team to ensure that the team give the best care to their patients. And this nurse supervisor also must be able to work efficiently and quickly under pressure and know how to keep their patients and staff calm and under control. So this supervisor needs to communicate effectively to the family members and to the team. And the supervisor should work in various situations and know how to handle them accordingly. So when we see the function, role, responsibilities of supervisors within the nursing education and clinical nursing, we see that they are distinct from other counselor and administrator. The quality clinical supervision is founded on a positive supervisory relationship that promotes client welfare and the professional development of the supervisee. So the supervisor will have various roles like teacher, coach, consultant, mentor, evaluator, and administrator. Let us look closer to the supervisor role. As the teacher, the supervisor will assist in the development of counseling knowledge and skills by identifying learning needs, determining counselor strengths, promoting self-awareness, and transmitting knowledge for practical use and professional growth. In the role of coach, this is a supportive role. The supervisors provide moral building, assess strengths and needs, such as varying clinical approaches, model, cheerlead, and prevent burnout. And in the role as a consultant, according to Bernard and Goodyear, they will incorporate the supervisory consulting role of case consultation and review, monitoring performance, counseling the counselor regarding job performance, and assessing counselors. So in this role, supervisors also provide alternative case conceptualizations, oversight of counselor work to achieve mutually agreed upon goals, and professional gatekeeping for the organization and discipline. And the supervisor role as a mentor, it means that this experienced supervisor will teach the supervisee through role modeling, facilitates the counselor's overall professional development and sense of professional identity, and trains the next generation of supervisors. Some people might be questioning about the difference between supervisor and manager. So let's see some questions to see the difference between supervisor and manager. The first question is, will this person have hiring and firing powers? Another question is, will this person set objectives for their direct reports? Will this person make critical decisions about resources are spent? Does this role require big picture thinking aligned with the company goals? And another question that we can ask to differentiate between supervisor and manager is, will this person be asked to make decisions regarding the direction of the department? So if we answer yes to most of these questions, it means that we are looking for a manager. So if we are looking for a person who is competent in a specific role, they will be overseeing and whose job will be to ensure quality and compliance from their direct reports, then you are looking for a supervisor. So we can see that the supervisor is the first line manager, someone whose main priority is managing people. And the role of supervisor is people-oriented and focuses on monitoring the performance of the team members and ensuring that the team members meeting their individual targets and goals. To put it in a simpler way, the manager will have a higher order people management skills and business strategy skills, while the supervisor should have a more in-depth knowledge of the day-to-day work done by the employees they are overseeing. So here is the job description of supervisor versus manager. The supervisor will supervise the staff, organizing and developing employee schedules. The supervisor will train the new employees, monitoring the work progress, monitor expenses and supplies, and will oversee the operational logistics. While the manager will manage the staff, doing the planning department activities, evaluate work effectiveness. The manager will manage expenses and resources, and she will develop budgets and performing cost-benefit analysis. He will do the recruiting, hiring, and evaluating the employees. The manager also will review the performance and will direct the operational logistics. And the manager also will develop strategies for meeting departmental objectives. So the supervisory job description would be more likely to require experience doing the exact work of the employees he or she will be overseeing, while the manager job description would be more likely to require broader people management experience. This is another way to differentiate between supervisor and manager. The supervisor will supervise the employees at work as well as their day-to-day assignments. The supervisor will report to manager. The supervisor doesn't have the right to hire, fire, or promote. The supervisor has main focus on each employee and their performance. And the supervisor will sometimes they are considered as the lower level management. While for managers, the manager will oversee the entire team or department, and the manager will report to board of directors. The manager has complete authority to hire, fire, and promote the employees. And the main focus of the manager is for the team's future and planning for it. And the manager considered as the middle level management. So in this pyramid, we can see that the supervisors are in the lower management. Then if we see the managers, they are in the middle management. We see that the supervision is an important aspect in the nursing education and the clinical area. Supervision is a cost-saving process, as the supervision will enhance the quality of care. The supervision will improve the efficiency of counselors in the direct and indirect services. The supervision will increase the workforce satisfaction, professionalization, and retention, and will ensure that services are provided according to the mandates and ethical standards. So here are some central principles in the supervision, especially in the area of clinical supervision. The first principle is that supervision is an essential part of all the clinical programs. The second is it will enhance the staff retention and morale. The third is that every clinician, regardless of level of skill and experience, needs and has a right to clinical supervision. The fourth is clinical supervision needs the full support of the agency administrators. Another principle in supervision is that the supervisory relationship is crucible in which ethical practice is developed and reinforced. Another principle is that clinical supervision is a skill in and of itself that has to be developed. And other principle is that culture and other contextual variables influence the supervision process. So the supervisor needs to strive for cultural competence. And another important principle in clinical supervision is that the successful implementation of evidence-based practice requires ongoing supervision. And the supervisors in the clinical area have the responsibility to be the gatekeepers for the profession. And clinical supervision should direct observation methods. According to Jayoba, there are two types of supervision. The first type is internal, and the second one is external. So in internal supervision, as the name implies, this type of supervision is carried out by the internal supervisor in the school as the principal, headmaster or mistress, their assistant, or the heads of the department. So it is also referred as school supervision. And one example of an effective supervision is the clinical supervision. This is a clinical approach to school supervision. And according to Goldhammer and Krajewski, clinical supervision refers to a close observation, detailed face-to-face interaction between the supervisor and the teacher that aims to bind the two in an intimate professional relationship. And this clinical supervision is perceived as a model with certain stages. For external supervision, this is the type of supervision that carried out by the people designed by the Ministry of Education to carry out the supervision in the schools. And these are the inspectors who are expected to do their responsibility to inspect the schools and work directly with teachers to improve the quality of instruction in the school. External supervision can further be divided into four main types, namely full inspection, follow-up inspection, partial and recognition inspection. Other type of supervision is direct and indirect. And I found that there are many types of supervision, like autocratic, laissez-faire, democratic, and bureaucratic. So in direct supervision, it is a supervision that the supervisor will present at all times, and the supervisor will oversee the activities as they occur and provides constant direction, feedback, and assistance. While the indirect supervision, it is characterized by some form of authority over the work of employees, but not under direct supervision. It means that the supervision will be responsible for the work, but not for the worker. There are types of supervision that classified according to the behavior of the supervisors toward the subordinates, and these are also called as techniques of supervision. Autocratic supervision, also known as authoritarian supervision. This is a leadership style characterized by individual control over all decisions and little input from group members. Autocratic leaders make choices based on their ideas and judgments and rarely accept advice from the followers. And under this type, the supervisor wields absolute power and wants complete obedience from his subordinates. So these are the characteristics of an autocratic leader or supervisor. The supervisor will tell and enforce. The supervisor will need only little feedback from the team. And the leader or the supervisor will decide on process, task, goals. And there is sense of frustration of the members. And this supervision style points a method how to get the job done. And also no real sense of empowerment. Normally morale can suffer in the long term. Research indicated that due to the nature of authoritarian leader, that she's the one who decides and controls the group, the creative problem solving is often thwarted. But there is certain time that the supervisor will use this style of leadership or supervision. This kind of supervision will be used when a task is urgent and needs to be completed quickly with little time for thought and planning. And we can use also this kind of supervision when skills are not enough, or are in short supply, and people need to be guided through a task. And when to use this supervision style is when there is little or no margin of error, and we can use this supervision style when the conditions are dangerous. Another type of supervision is laissez-faire. This comes from the French phrase means let them do. This is also known as independent supervision. And in this supervision, there is maximum freedom given to the subordinates, and the supervisor will never interfere the work of the subordinates. It means that the supervisor gives full freedom to the subordinates to solve their problem. Laissez-faire leadership, also known as delegative leadership, in which leaders or supervisors are hands-off, and they allow the group members to decide. And a research found out that this leadership style leads to a lowest productivity among the group members. We can see the characters of the laissez-faire supervision. The first one is there is only limited guidance from the leaders, and there's complete freedom for the followers to decide. Leaders provide the tools and resources, and the group members are expected to solve their own problem. And the last is power is handed to the followers. So laissez-faire supervision is effective in a situation where the group members are highly skilled, or they are highly motivated and capable of working on their own. Since these group members are experts and knowledgeable, and they are skillful to work independently, so they are capable of accomplishing tasks with very little guidance. Another type of supervision is democratic. Under this type, the supervisor will act according to the mutual consent and discussion to the subordinates, especially in the process of decision making. Subordinates are encouraged to give suggestions, initiative, and judgment. And this leadership style is a very open and collegial style. So the group members are allowed to give ideas freely and openly. So when to use the democratic leadership? We can use this kind of leadership or supervision when situations change frequently, and the leadership needs to be flexible, be able to adapt to the situation. So this style of leadership or supervision can bring the best out of the team, because it will capitalize the skills and talents of the members. And if the decision is very complex and abroad, so it's good to have this or to use this style of supervision. In the bureaucratic supervision, the supervisor will lay down the rules and regulations that need to be followed by all the subordinates, and they need to follow the regulations very strictly. And sometimes this will bring stability and uniformity in the organization. But in actual practice, it has been observed that there are delays and inefficiency in work due to bureaucratic supervision. In bureaucratic supervision, the supervisor relies on rules and regulations, so they tend to be the people who are well organized, and they like to report to their immediate supervisor or their CEO in the company. And employees in bureaucracies are promoted based on their ability to conform to the rules. So in this kind of supervision, it's based on strict hierarchies and often depends on written job descriptions and organization charts to explain the hierarchy and the relationships. Within the nursing field, there are a variety of ways of clinical supervision. Let's take a look at some different ways how the clinical supervisor will handle the supervision. The first way is to do the one-to-one supervision. The other way is to do one-to-one peer supervision, to do group supervision, and another way to conduct supervision is to do a peer group supervision. In one-to-one supervision, this is a type of supervision is strictly between a nurse and a clinical supervisor. The nurse and the supervisor will work closely and typically share the same field of specialty. And this type of clinical supervision will allow trust to develop between the supervisor and the nurse, and they can share feedback to improve their nursing skills. In one-to-one peer supervision, this is a type of supervision between the two nurses of equal status that taking it turns to supervise each other. And the benefit of this type is that there is no supervisor or authority figure in the process. So this type will encourage independence. But this type of supervision is not appropriate for inexperienced nurses. In group supervision, this type of supervision will involve a group of nurses who meet with one clinical supervisor and share important components of their caseloads. For example, each nurse will take turns presenting the case to the group, and then they will receive feedback to improve the nursing skills or ideas. And in this type of supervision, allows a nurse to receive multiple perspectives of their case, which in turn will provide their ability to stay open-minded during the supervision process. Another type of clinical supervision is peer group supervision. This is similar to the one-to-one peer supervision, where this supervision allows the group of nurses to meet and discuss their caseloads or challenges they are experiencing. But we need to be careful when using this type of supervision that sometimes the nurses will be away from the topic or from the attention, because the discussion might become too informal. But on the other hand, this type of supervision will allow the nurses to discuss their personal experience without anyone being in charge, and this style of supervision can allow the nurse in the group to be more forthcoming with each other. Models of supervision. According to Bernard and Goodyear, models of supervision can be categorized into four. They include developmental model, integrated, social role, and system model. We will look closer to each model. The first one is developmental model. This model is supervision where there is notion that individuals are continuously growing. So the objective of the supervision model, it is to maximize and identify growth needed for the future. So in general, this developmental model is to define the progressive stages of supervisory development from beginner to expert. The second model is integrated. Supervision is a complex activity, and there is a need for an integrated model. Integrated model of supervision are described as eclectic. This allows the clinician to integrate several models into a working paradigm. Some supervisors may choose to lecture, most typically during group supervision. Others prefer to counselor approach, moving into areas of the supervisor's psyche to uncover unconscious motives and desires. Other supervisors may find themselves in a co-therapist role with the supervisee. Regardless of the role, each integrated model serves a specific purpose. The purpose is to help identify obstacles that prevent the supervisee from learning, growing, and ultimately helping the client sitting before them. The third model is social role. The social role model specifies that supervisor acts and performs certain roles, tasks, and functions that take into account behavior, beliefs, and attitudes that the supervisee is expected to do. And the last model in the based on Bernard and Goodyear is system model. This model emphasizes a learning alliance between the supervisor and supervisee. This alliance is based on the relationship between the supervisor and the supervisee. So it has been concluded from this presentation that there are various models of supervision that can be used by educators in the educational system, which contribute in achieving educational goals and objectives. There is no one model that is superior to the other. We have reached the end of this presentation. I hope you can learn something about supervision, and thank you for watching.